So welcome everyone. A weekly update for us on our testing program for this school year. And today, as always, I'm glad to be gathered together here with our colleagues virtually, both from DESE, from the Shaw Foundation, and from our COVID Command Center, sometimes in our slide referred to as the Executive Office of Health and Human Services. And we are all gathered, we're all working really diligently to just improve this program as much as we can and get you the services and supports that you need and to answer your questions. And today, a lot of what we're going to do is talk about answering questions. What's happening? Where are we going? What are we doing to support you? We'll also talk about some Shaw Family Foundation resources and our next steps as well. So just to begin with some of those frequently asked questions, really the main question that we're getting asked right now is about staffing and the challenges of having enough staffing to fully implement this program. So we just want to acknowledge right from the beginning that we know that there have been some slow arrival of staff to materialize in many of our school districts for many of our schools and districts. And we're really working aggressively to deal with this issue. We know how important it is, the additional people that we've committed to making this program work. So what I want to leave you with today are three important things that we've done. First, what's really important is that to keep in mind that CIC is our contractor and all of the staff who are coming into your buildings are subcontractors through CIC. CIC and DESE and HHS, we all agreed that we would start the year, we felt very aggressively with 14 subcontractors. That's not an insignificant number of subcontractors working with CIC. What we've realized, especially based on the very high level of demand for these services, which we appreciate, we want to deliver on that, is that we need to double that amount. So we are aggressively working, CIC is aggressively working to double the number of subcontractors in a very short period of time. And we're already onboarding 3 more today. So that should really help with our bandwidth to get more of the staff to your buildings in a short period of time. And I know that CIC is working to just, very much vet and make sure that we'll have quality resources coming to you with these additional subcontractors. So that's, in our mind, that's job one of just making sure we fulfill the need, the demand, and really increase the bandwidth right now. The second thing that I just want to mention is that if you're struggling with the implementation of your testing program, and particularly around staffing issues, please reach out to us right away. Please don't let things fester. We are escalating rapidly. If you've reached out to me personally, to Lauren, to our K-12-19 testing email address that you see on your screen right here, that is the best place to go. We immediately contact CIC, and CIC has been very responsive. They're reaching out to districts to find out what's going on, because what it would be helpful maybe for you to know is that sometimes what we can see, for example, has a program coordinator been assigned to a school, we can see that on paper. We can see yes or no, has a program coordinator been assigned, but is it actually working out? Are they a good match? Are they showing up regularly? That we need the qualitative information from you about. And so if you're struggling with the arrival of staff, once you get that connection and making the connection work, if there's a breakdown there, just please let us know right away. We will, I promise you, the same day we will follow up with you to address these issues and work towards a resolution. The other thing though is we don't want to wait for you. We don't want to wait to find out from you where there are problems. So CIC has made a commitment to proactively reach out to every, I put district, but keep in mind I mean school and district, right? So if you're a private school, we'll be reaching out to you. If you are a school district, we will be reaching out to you. If you're an education collaborative, we will be reaching out to you. Within the next week, you'll be hearing from a representative at CIC, because again, there are a lot of nuances to this. It's, have you been matched, and is the match working out? Are staff showing up? We need to get under the hood to understand those issues and then know what we can do to correct them. And so again, 3 important things. We're doubling the number of subcontractors we have working with us. 3 are onboarding today. If you're struggling, please reach out to us right away. Don't let things fester. And then finally, CIC will be following up with you proactively to make sure that we know what your concerns are and that we work to address them right away. We do have some additional ideas though to share with you today that I hope you'll sort of reflect on and decide, are any of these ideas right for you? in order to make this program work as effectively as possible, and particularly with what we know is just, a real high demand and, a concern across the board in all sectors right now of finding enough staff to provide human services. So one idea is, of course, and we've talked about this before, is just if you do have a way to have, for example, part-time school affiliated staff members to assist with launching the program, we're finding that can be a stopgap measure in, in a short period of time. What I want to do right now, though, is talk to you about how we could fund those additional staff members. A couple of ideas. So first of all, if you have identified, for example, that let's just say somebody who's working in an after-school program has some additional hours, and they could work in the morning to support the testing that you're doing in your schools. We could get them connected with CIC to be hired as a subcontractor, as an individual subcontractor to CIC, who could then compensate that individual. So again, that could be somebody working in an after-school program. It could be, just somebody else from within the community who could be qualified to do this. Could be hired as an individual subcontractor instead of the firm, the agency that's been assigned to your district. We could also break that out and have individuals hired as subcontractors to support this work, and then receive the compensation through CIC for their efforts. So that's on a compensation model, right? They would be paid directly by CIC to do the work. Let's also talk about a reimbursement model. So if you are hiring your own staff to do this work, we have been double checking and confirming with FEMA. We talked about this last year, that FEMA is able to provide reimbursement to cover costs associated with our testing initiative. And so what we'd encourage you to do is to, if you want to go down this road, would be to contact the email address that we see there, disaster.recovery@mass.gov, to investigate this further and to get the information that you might need in order to do this. We have heard of some successful examples from across the state, because we're working to set this up for you, but we're not party to it. We're not part of the reimbursement process. It's directly from the municipality and FEMA through MEMA, through the Massachusetts Emergency Management System. So I have a couple of additional tips to share with you today that I've heard from a particular district who had success with receiving FEMA reimbursement for expenses they had last year. And a couple of things. What she advised me was to coordinate with your EMD, your emergency management director. I know when I was superintendent, it was my fire chief. It very often is the fire chief who is sort of that conduit for FEMA reimbursement. And so looking to see what you might be able to do to team up between the school district, for example, and your local EMD to talk about how a submittal for FEMA reimbursement can happen. It's important to note that with FEMA reimbursement, it's likely easier to get reimbursement for a contractual arrangement, like a contractual cost. Personnel are going to be a little bit more time consuming to claim them for FEMA reimbursement. Just want to be honest and upfront about that from the beginning. But there is an avenue for it. This district leader advised me, though, to say that what was helpful to them when they went to claim for FEMA reimbursement is that they've really kept their records clear as to what are COVID-related expenses and that are unique COVID-related needs that the district has fulfilled through financial commitments, to have that separate from their other operational costs, so that's not all big, kind of one, all lumped together in terms of their expenditures. So they can really carve out and show those COVID-related expenditures, very much help them when they want to apply for FEMA reimbursement. So if you are interested in this, please reach out again to, I'll put the email address back on the screen, reach out to that the K-12 COVID-19 testing at mass.gov email address, the one that you're probably coming to for a variety of reasons right now. And if you want more information, we'd be glad to connect you directly to this district leader who's willing to work with people on an individual basis if they have questions or concerns about how to claim FEMA reimbursement. The other potential way to cut down on the number of staffing that are needed to pull off our testing program is, I think, a pretty ingenious idea that came to us. I heard about it directly from Dr. Sawyer in Shrewsbury, the Shrewsbury superintendent and his team and deep gratitude to them for bringing this idea to us. What they've done in Shrewsbury, and we understand some other locations in the state as well, is to create a centralized test and stay location. So instead of test and stay happening in every building, what they've done in Shrewsbury is they've created a central location that's open at 6:30 in the morning. It's a drive-through, and families are arriving there before school, bringing their children who need to be tested for test and stay. They're getting that quick BinaxNOW swab, getting those results there in the parking lot at this drive-through facility that they've set up. And they are then getting the either all clear, you can go on to school. They've named it a hall pass that the parent gets to be able to pass on to the nurse. The hall pass that allows the student to return to school. If it's positive, the nurse would would let the parent know that they need to go home and follow up with a PCR test. And so, what they're finding with this is that it's cutting down on the number of staffing they need for test and stay because it's all happening in one location. It's also, taking some of the pressure off of the school itself for having, for example, a location to be running test and stay and as much space that you would need from within a building for test and stay. That can, perhaps be handled offsite. If you could find a facility that would work in your district, that would be very helpful. And so, that it's an idea that could work in other districts in the state. Maybe not all. Maybe it's, kind of needs some unique conditions. There would be, supplies that you would have to provide that CIC would not be able to provide, such as, just their tables and chairs and just, some of the unique equipment that would come with a drive-through location. But again, just really appreciated hearing about the success in Shrewsbury. Wanted us to share this both with CIC, so CIC can be looking for communities where this might work, and also just to share the idea with you as an idea, as a way of perhaps expanding this if it would work in your community. If you are using a new site, just keep in mind that it does need to be added as part of the district's CLIO waiver. Again, that's not a hard process. We have included the link right in this PowerPoint to support you with this. But it really, it could help with some of this demand on staff that we're facing across the state right now to think about a centralized test and stay location. I want to just move on now to some other updates that you should be looking for as we move ahead. The first is that we had, very good advocacy, particularly from district leaders, coming to us to say that the gender options on the consent form were not inclusive, and appreciated our collaboration with DPH on this. We were able to update the options on the consent form so that they are broader than what they had been. And you don't have to go back and ask for consent again, right? If people have already consented, you don't have to change what they've consented to. But going forward, the options have changed, and we appreciate the advocacy from districts to make that happen. The final thing that I want to talk about in the way of information for you is our updated FAQ. I'm going to show you a couple things on slides right now, and then a couple of things I'm just going to show you directly in the FAQ. Lauren, are you putting the FAQ in the chat as we go along here?
Yeah, I'm actually going to put the link to our COVID-19 testing page, which is right here. The FAQ has been posted.
Okay, great. So it's posted on our website, which is the link that we've included right here for you. So there are a couple of things, like I said, that I want to just talk about that we've made slides for, but then I actually am going to flip over to the actual FAQ where I've prepared a few key questions that I want to just review with you because we're hearing from, different places across the state with some of these same questions. So it might be helpful just to review them together. So the first is just about ordering BinaxNOW tests. How do you order them and when should you receive them by? So the program coordinators from the subcontractors associated with CIC Health are going to be able to handle that BinaxNOW ordering on behalf of the district. If you do need to order them on your own, you can order them using the form link that we've included right here on this page. And we ask that you, really work to request the number of tests that you anticipate needing for your district. And remember, district we're using broadly to mean districts and independent schools as well. And so, thinking about how you're going to calculate that, thinking about that, it doesn't have to be all close contacts entered into test and stay. Only the unvaccinated, asymptomatic individuals who are exposed need to be thought of for close contacts, right? So when you're trying to calculate the number that you'll need, we really want to make sure we're not identifying an entire classroom, for example, as close contacts. We really want to narrow down to who were the individuals who were exposed between 0 and 3 feet for at least 15 minutes while indoors. That should be the way that we calculate the number of Binax Now tests that you will ultimately need. And they can only be delivered to a centralized hub in a district. And I know that this has definitely created some confusion. And so just really want to clarify this further right now, that you're going to identify what that centralized hub is and then work on reallocating those tests from in district from that centralized hub out to the schools. And it's taking about 7 days from the time in which you place the order to it being delivered to that centralized location. So just keep in mind that, how much time is it going to take for turnaround from within the district to redeploy those resources from that centralized hub. But Lauren, let me just pause there and check and see if there's anything else we need to add about ordering.
Nothing about ordering, but just doubling down, Russell, on the idea that not all close contacts will need to participate in test and stay. And so it's really important to be able to look at our responding to COVID-19 protocols document, which I can also link in the chat. The definition of close contact is still individuals who were within 6 feet, but only individuals that were within 0 to 3 feet need to then participate in the test and stay. And so looking at the exemptions for close contacts to participate in our protocols, we get a lot of questions about 0 to 3 versus 0 to 6 feet. And so what is the difference there? And so really encourage people to look closely at the protocols for responding to COVID-19 scenarios, which again, I'll link in the chat to understand the nuances.
Great. Thanks very much. Really appreciate that. Staying with the theme of Binax Now. We talked about this a little bit the last time, but because there's definitely some question and need for clarity out there. So just going back over this, that your Binax Now tests will not expire. Most of them will not expire until December. But to determine when your test will expire, locate the lot number on the Binax Now box, not on the individual test. So they come in a box and of 40, 20. 40. Excellent. 40. Excellent. Coming in that box of 40, and the box itself is where you locate the lot number. Then using the link that we have on the slide here, you can then look up that lot number and determine whether or not it's expiring or not based on the information that you can find from that link. Lauren, just let me check again to see if there's anything else about expiration date, or Jeremiah.
Yeah, just
nope,
thanks, Russell.
Totally...
One quick.
Go ahead. No, go ahead, Jeremiah.
Great, thank you. One quick note I'd add is just anything that we've shipped out since August forward, those don't have expiration dates until December. So if you have kits left over from March or April or May or something like that in the spring, it's possible that those are starting to expire now. But just want to be clear, you should not be too worried about anything that you just received from us. That's all.
Great. Jeremiah, so let me change my view right now so that we go over here to the updated FAQ. And so like Lauren said, if the link she has shared in the chat will take you to the updated FAQ. And I'm just sharing that on my screen. Lauren, let me just double check that that's what you're seeing.
Yep, that's right.
Great, I'll make it bigger. Okay, so what we've done is to anything that's new, we've highlighted in yellow here. So you can see that it's a new date. So if you've read through our FAQ before and you want to go more quickly to what we've added, you'll find that there are a good number of questions. Some of the questions we brought over from our FAQ from last year because that was archived. And there were some questions that were beginning to come up this year that we thought, wait, we answered that last year. We'll just pull it into this FAQ so that you can find everything you need all in one place. So while it's labeled as new, it might not actually be new information for you if you participated in the program last year. So a lot of at the beginning here, I've already talked about in terms of the staffing and additional ways to receive either get staff compensated or to receive reimbursement. Again, are repeated in these questions here in the FAQ. But just scrolling down, want to just mention right now real quick, because we are getting this question a fair amount about who can self-swab. And so please remember that students themselves and staff, students and staff, are not allowed to self-swab with BinaxNOW. So self-swabbing can occur with our pooled testing, but not with BinaxNOW. And so if there's any confusion about that, just really want to dispel it and make sure we're very clear that that is an administered test. It's not an observed test. Also want to just follow up real quick about what happens if when you're following up with positive pooled members using BinaxNOW, if all of the BinaxNOW tests show up negative or result in negative results, keeping in mind that all negative BinaxNOW tests likely mean that whoever was infectious has a very low level of infection right now. But we still want to get to the bottom of it. We still want to do our best to understand what's happened here. And so if this occurs, there are two options. You can either do a second BinaxNOW on all individuals who are involved no sooner than the next day, but within 2 days, right? So sort of a 1 to 2 day window that you would follow up again. Keep in mind that all individuals would remain in school as long as they're asymptomatic, or retest all individuals using an individual PCR test, and that can be done the same day. So you have two options. You should be able to work with your program coordinator, your clinicians, to be able to exercise which option is most valuable to your school community. But Lauren, Jeremiah, I know that there's been some questions on this, so anything else that you want to add?
Just one quick thing for me, Russell, is that we say that you can collect the PCR on the same day. We've seen a lot of schools have success with collecting it at the same time. So if you have a positive pool, you collect a BinaxNOW sample and another sample, and then you only use that PCR sample if you don't find your positive on the BinaxNOW. And that just reduces the amount that you're having to run around the school building trying to find everybody that was in that positive pool.
Jeremiah, can you just say that one more time, just so
Sure.
we make sure people are understanding it? There were a lot of variables
Yes,
there.
I worry that that was not clear. So we've, on the BinaxNOW not finding your positive person in the pool note, we've seen schools have success with taking 2 samples after a positive pool, one for the BinaxNOW, which they can run immediately, and then one to hang on to in a PCR tube, so that if they end up not finding the positive person using the Binax, they already have an individual sample for PCR for everybody that was in the positive pool. So you don't have to call people back down or go find them or whatever it is. And then you would only send the PCRs in, obviously, if you did not find the positive on the BinaxNOW, which will be, something like 20% of the time.
Great. Thanks for that tip. Appreciate it.
Yeah.
Great. So just a couple other things that I've highlighted here. You can see that there are a lot of questions that we've, stay the same, but a few that have changed. And, this has been a big question across the state about where right now, when parents consent through our portal, they are consenting to all 3 forms of testing. We think this is important. We think this is the right thing to do because we want to make sure that we are using pooled testing, using our routine COVID safety checks as a surveillance method to find out, what is the existence of COVID within our schools. So parents who are consenting are doing something for the community by participating in pooled testing. And then they're also getting the kind of individual support of symptomatic testing or test and stay that really focuses on their individual child. And so, we hope that you can continue to message that consenting to all 3 forms of test does something for the community and it does something for their individual child. We understand, though, that there are some circumstances where families are very reluctant to sign that consent form that has all 3 forms, where they have to consent to all 3 forms at once. And so it is allowable for districts to use a paper-based consent and ask parents or allow parents to sign the paper-based consent where they can select kind of a la carte from within the 3 which they choose to participate in. Districts do not have you're not required to make this available because it is a management issue. You would have to track both who is consented through the electronic portal and who is consented on paper. You kind of have to keep both lists in mind as you go to determine who needs testing. And so if you so choose not to use the paper-based consent and stick with the online testing only through the portal, that is fine, because you need to make sure that you can run this program first and foremost. And again, we just really hope that we can use one consent form that gets as many children involved in this testing as possible so that we keep our schools as safe as possible. And so we hope that having this in writing will be useful to you as we go forward. Let's see, the EMED test. I think this is my last one. There have been some questions about who is responsible for distributing the EMED test to a student if they are, participating in a weekend event, an extracurricular event on the weekend. That's the allowable use of EMED right now, based on the supply that we have. And so it's the school or district that has to distribute the EMED test to the individual participating in the school, because it's going to likely happen maybe on a Friday afternoon. You need to know who needs to be going home with those EMED tests. And so it will be the school or district that needs to administer the EMED test. Oh, I did have a couple more, sorry, but they do relate to EMED. So the information about downloading the app that supports EMED can be found at the link that we've included in the FAQ if you're kind of struggling to find that information. The informational video, all the directions are included at that link for EMED. And then, we've used EMED as sort of an umbrella term, and we know that there's some confusion about the box itself doesn't always readily say EMED on it. And so we just want to make sure that we're clear that these home tests, as seen here in this image, are what we're talking about as EMED. And we just want to make sure that we share this example with you today. So those are my main ideas to share as part of our FAQ. I'm sure there are other questions that we'll get to in just a minute. I'm going to try not to make us all a little bit dizzy going back and forth with the presentation, but going back into presentation mode so that we can talk about some Shaw Family Foundation resources. Laura, are you seeing this?
Your notes.
All right.
No. In your
yeah,
notes
exactly.
section.
Thought that might happen. Thank you. Stop the share. Bear with me. Here we go. Sharing screen. And as we say in my family, hopefully cooking with gas. Let's see if this works. How are we now, Lauren?
Set. Great.
All right. Cooking with gas. Let's go. Shaw Family Foundation resources. Really love what Shaw has done for us in the way of some additional, what they call cheat sheets. In education, we try not to have cheat sheets, but we're gonna embrace this right now with the support from the Shaw Family Foundation. We know that you're looking for some down and dirty information about how to use each of the different software platforms. And so for each of the platforms that you see listed here on the left, Shaw has created a link to where you can get just the sort of the really basic information that you need about using that platform. And we hope that you'll find this useful to link into them. I'm sorry, this is where you can link to the actual software platform, and then their cheat sheets are available through the link that's included in this slide. And I think it's also helpful that to remember what each platform is used for, because some of you're using different combinations of platforms based on the choices that you've made to us, with whichever testing option you've selected for your school or district. So let's just wrap up and then go to your questions, looking at just some next steps. Remember, we just want to keep sharing with you where you can go to get information from the DESE web pages. And so we've included a link to you for where you can go to find out information about our testing program, the slides from today's presentation, the recording from today's presentation, for example, the updated FAQ, the contact tracing resource that we've shared with you previously are all available on this page. Are on the desktop is where we have updates about protocols for responding to COVID-19 scenarios. I anticipate there'll be some more information coming this week. Again, just reinforcing this idea of who should be identified as a close contact. That, again, that we don't want to identify an entire classroom if we can avoid it. And so that would likely be posted here on the desktop page, and then our general FAQs, where you can continue to see updated information that we always include in the Commissioner's Weekly Update. For those of you who haven't gotten started with us yet, just a reminder of where to go to get started using our authorized school application and statement of assurances. And then, if you're requesting EMED tests or Buy Next Now, we included that information as well. And finally, just a reminder that, getting in touch with us is really important as early as you can. And so the usual line of defense, going to your program coordinator, going to CIC, and then coming to us. But again, please don't let issues fester. We really want to hear from you as soon as we possibly can. So that's it for today's presentation, and really glad to hear your thoughts, questions, concerns. One final thing that I just want to mention briefly, I didn't put this in a slide, but as another consideration with, maybe a segue, I'm sure a lot of the questions are going to relate to kind of how do we get from where we are right now to full implementation with a lot of the, the startup issues that we have faced. Some districts are coming to a realization that the double swab is time consuming because we have to collect more personally identifiable information than we do for a single swab for pooled testing. So some districts are deciding that until the staffing gets fully worked out, they would switch to single swab with follow-up testing using Buy Next Now instead of the double swab for in-lab follow-up testing, because of the additional staffing time that it's taking to do the double swabbing. I'm not saying that that is a panacea. It might not be the right choice for you, but it is a consideration. Some districts are temporarily making the switch just because they can get through more students more quickly using a single swab that requires less personally identifiable information than the double swab. We are working to make that double swab data gathering and information labeling faster, so the double swabbing will go more quickly. But in the meantime, it is also a consideration for you to think about, and again, really need to decide if that's the right thing for you and your community. Lauren, I'm glad to turn it over to you right now for questions and answers. I know that you and Jeremiah and I can all chime in to answer these questions that we're getting from participants.
Yep, there are a lot of questions, Russell. I've been doing my best to answer a few of them in the chat already. But before we get started with that, a lot of people are asking for the slides. And so I am going to add them to the chat right now so that you can download them and then have access to all of the links. They will be posted on our website, hopefully by later today, if not tomorrow morning. But I'm just going to put it in again so everybody has it. And you can download it right from the chat. So actually our first question has to do with the pool testing supplies, and Jeremiah, I'm hoping that you'll be able to take this one, but they have a lot of districts are saying that they are delayed in getting their supply order. So what's the best way to ensure that they get their delivery of pool testing supplies?
Yeah, thanks, Lauren. The best way is to just make sure that you're staying in close contact with CIC, and where you're not hearing from CIC or where you're hearing that you're going to have to delay or don't have enough, to let us know so that we can have a more stern conversation with them. I'm curious, there's one lab in particular that's been having some supply issues that we're aware of, but as far as we know, they've been able to get out enough for each week of testing just on a weekly basis. So obviously that's not our preference, that's not what you want. We'd like to give you 2 or 3 months at a time so you don't have to live hand to mouth like that. But I think where you're actually having an issue of we do not have enough for today or tomorrow or this week, please let us know.
Great. And there's a question about what credentials are needed, Jeremiah, if you can take this one again, to be able to be hired by the subcontractors to do either the specimen collection or observation.
Yep. So there's a background check that the subcontractors have built into their process. Obviously, that does not and should not preclude you all from running Courier Checks or whatever you feel is necessary for folks that are coming into the school. For the actual administration credentials or observation credentials, There's not a medical certificate or degree or qualification that's required. Some of you who were doing Binax Now testing in the spring might remember that there was a set of training videos on the test maker's website, and those qualify you to administer the test. So that's the sole qualification for the Binax Now. For the PCR swabs, there's a separate but similar training process for them. So that's what's required there, Lauren.
Great. And there was just a question about the Courier Checks. It is not the expectation that the school will run the Courier Checks. The subcontractors are doing that for their individuals and for the people that they're hiring. However, if a district has specific requirements in regards to obtaining courier background checks, they can implement that as well.
Right. Thank you, Lauren.
Russell, great.
Lauren, one other quick thing on that.
Yeah.
Just keeping in mind that during the time that you're waiting to get if you choose to have staff, subcontracted staff get fingerprinted and quarried, they can come into your building if they're escorted, which I know is a time taker, but if there is a way to get them started and have them escorted in your buildings, which might be possible, that's a consideration as opposed to waiting for it to be completely finalized in order to get started. So that's just an idea to share as well.
There are a lot of questions about hiring local staff to be for CIC to hire local staff as subcontractors. So I think our best next step would be to create a short list of FAQs. There are questions about standard hourly rate, the credentials again, and what type of tasks might a subcontractor do. So we will be in touch with some updated FAQs to be able to address those questions. Russell, there were questions about the centralized model to administer test and stay. Do we have a particular contact or additional information that we could provide districts if they would like to know how to operationalize that for their own district?
Yeah, and that might be something we could follow up on as well. Like I mentioned, I really appreciate Shrewsbury's model that they've shared with us. And like I said, it might not be right for everyone. There could be some other solutions. Are there other, centralized locations? It might not be one centralized location, but maybe we could gather some more information of, exactly who to contact. I don't want to send people down a path that won't be fruitful. And I also want to make sure we don't overwhelm district staff who have been willing to share some of these good ideas with us. So we can follow up on that.
Great. Jeremiah, next few questions are for you. So a question about the disposal of the Binax Now test. Is it regular trash or biohazard waste?
Yep, thanks, Lauren. And there's some confusion here, I think, just because this started in one place in the spring and then we moved to a different place, which is where we are now. So when we had started, it was biohazard waste, and then we consulted with our Bureau of Environmental, the folks who manage that, and they let us know that given that Abbott has the test maker has other EUAs for the Binax Now, which include household trash, that this is something that you can include in the regular trash. And they did note that as a precaution, you could Ziploc the sample, the swab in the card. So just put that in a little plastic bag and close it and then put it in the garbage.
Great, thank you. And then there's a question about a sample standing order.
Yep, thanks. This is something that we're working on getting to you all very quickly. There's been a little bit of back and forth between us and the Department of Public Health, and I understand that to you all, this is just the state. But we as the state are working on this, and we're going to get that posted as soon as we can. I had hoped that we would have it by today, but we don't.
Great. And then Russell, could you just reiterate the rationale for why we are including in-school close contacts in our test and stay protocol and not out-of-school close contacts or home-based close contacts?
Yeah, and we appreciate everyone's sort of diligence at figuring out which is which. It's really important to keep in mind that our schools are what we consider managed environments. We have students sitting in desks, we have teachers monitoring behavior, we have such important safety mitigation strategies like right now the mask wearing, but always the staying home if you're sick, the hand washing, which is different than, I know that I'm constantly hassling my son to wash his hands at home. I'm not sure he listens to his dad as well as he does to the staff in the school. So, and we sit closely on the couch and watch TV or whatever, our home environment is so different than a school environment. And so close contacts that happen outside of school are usually happening in less managed environments, not always, but usually. And we really have to draw the line to say, we're taking a risk by identifying that close contacts in schools can remain in school if we use this test and stay methodology, because it's not that likely, it's less likely, how about it's less likely that they are going to be positive individually, that they're going to test positive for COVID. Whereas we know that many out of school activities have been much higher, places where much higher rates of transmission have occurred. And so we're not ready to include them into something that is, taking on a slightly higher risk for the school, for the community, that could perhaps lead to more spread of the virus. So we're really trying to say this is a measured way of helping to keep kids in school, to maintain that continuity of learning without overextending the level of risk that we're taking that could contribute to the spread of COVID. We are right now, though, looking to see what we can do with EEC approved out of school time programs. There's likely to be more information on that in the next week or so, where we'll have some more guidance for you on students who are in EEC approved after school programs, particularly because those programs follow the same guidelines that we have around, particularly the mask wearing, hand washing, staying home if you're sick. So we're exploring that right now, and more to come, but we're not all the way there yet.
Great. And it is still our recommendation that all students that are not participating in school-sponsored sports or extracurricular activities quarantine outside of school or outside of those events.
Yes.
So Russell, I think we hit the bulk of those questions. Thanks so much. And we will, again, be updating our FAQ and be communicating with folks by email about any new updates or upcoming webinars.
Great. Thanks so much, everyone. Thank you for your time today. Have a great rest of the week.